Well, no matter how young at heart you feel, little can be done to reverse the signs of an aging heart. Until now, apparently, scientists have discovered a protein that may be able to keep our hearts young. Dr. Reisman is a cardiologist and founder of the New York Cardiac Diagnostic Center. So, Doc, let's start first things first. What happens to our heart as we age?
As you age, the heart stiffens. And the heart stiffens not only because of age, but because of frequently undetected high blood pressure or hypertension. When the heart stiffens, you can develop a condition called diastolic dysfunction, eventually resulting in diastolic heart failure. Heart failure is the inability of the heart to pump properly or the backup of blood into the lungs, and you get shorter breath.
Interesting. So that happens just as part of the natural aging process?
It does appear it's part of the natural aging process, but it also occurs frequently. The biggest risk factor is probably hypertension. It occurs with diabetes, and it occurs with a condition called aortic stenosis. But probably the most common one is aging and hypertension.
So these researchers at Harvard isolated this protein, and they tried it out on mice. And by injecting a protein into the bloodstream of the mice, they found that the heart looked remarkably younger in 30 days. Is this some sort of fountain of youth?
It's a very interesting study because it takes this protein called GDF11, growth differentiating factor 11. They found it in their experiments, and they injected it into mice that had stiffened or old age hearts. And over 30 days, they found they got better. So the initial findings are very interesting. I don't know exactly if it's applicable to humans. It'll take, as they mentioned, another 3, 4, 5 years to really possibly get some studies done. But
why does it take so long, by the way? Because when you hear something like this, it sounds so miraculous. You think, wow, when can we try this out on humans?
Well, the issues in humans is it has to be proven to be safe, and it also has to be proven to be efficacious or effective. So these clinical trials, you have to go through a hospital review board, you have to get approval from patients, and you have to do the study. And the study takes time. It takes several years.
So, Doc, I was thinking vanity always comes into this when it comes to anti-aging, whether it's your heart or anything else. First of all, why is a protein? Why would a protein be effective in this? And if it's effective potentially in the heart, could it be effective in other organs, let's say your largest organ being your skin?
Well, we do know that there are proteins and factors that can create new blood vessels called angiogenesis, which is effective in people who had heart attacks. Proteins have been found to be effective in musculoskeletal disorders, and certainly in the skin. I know there's a lot of research going on at this, but I think we're maybe not there yet.
Yeah, I was just maybe wishful thinking.
Maybe soon, hopefully.
But for you, just as a heart doc, you read something like this, what goes through your head?
What goes through my head is it's exciting, but I want to see what happens over time in humans, because not everything pans out. But I like the idea of it, and the findings seem very impressive, that they had reversal of this hypertrophy of the heart.
Just real quick here, it was interesting. I thought that they injected the protein into the bloodstream. I almost was imagining they would just put it directly into the heart. But why would it just go into the bloodstream?
Well, what happens is when they inject it into the bloodstream, it finds the location where it's going to be useful. And that's probably, all the blood goes into the heart anyway,
sure.
So it's going to get there.
Well, it's nice to be moderately excited about it, and we'll continue to watch the study and see if it's really anti-aging for the heart. It's exciting. Doctor, thank you so much.
Thank you.
Nice to have you in the studio. John?
Some good news there. Hundreds